The Northern Territory has recorded 2 new COVID cases. Let's go live to Matt Cunningham in Darwin for us this afternoon. Matt, there are concerns about some positive wastewater tests.
That's right. The real concerns about the wastewater testing that's come back positive in the community of Binjari, which is just on the outskirts of Katherine. That is of particular concern to authorities. There were 0 cases recorded yesterday. That was the good news. But today we have had 2 cases recorded. One of those cases is a health worker. Michael Gunter delivered that news at a press conference here just a short time ago.
There are about 200 residents in this community. A rapid assessment team has been deployed to Binjari this morning before the sun came up, and they are supported by the Worley Aboriginal Health Service. It's our intention to test every single person in the Binjari community today, and we'll also get more people vaccinated there today. The man was fully vaccinated, however he also has other existing health issues, so he has been transported to Royal Darwin Hospital for treatment. The woman is associated with one of the positive households, but had not previously been identified as a contact, either casual or close. She took a COVID test because she had symptoms. I don't have her vaccination status at this time. The interviewing and tracing for her has only just started, so there may be some new exposure sites later this morning.
So a couple of key points there. One is that community of Binjari, the testing that's underway there, a small community on the outskirts of Katherine, but that will be of serious concern, the fact that they have detected a positive sample in the wastewater that has been tested there. They expect to test every member in that community by the end of the day today, so we'll get a good indication as to whether there's been any significant transmission in that community. There's also concern that there have been close contacts identified in both Tennant Creek and the remote community of Yuendumu in central Australia. That will be of significant concern to authorities given the low vaccination rates, both in the Barkly region, including Tennant Creek, and in Yuendumu itself. So there are contact tracing efforts continuing there and people trying to identify further close contacts in that area. But those 2 new cases brings the total of this cluster to 25 cases. Last night the government was able to use genomic sequencing to link this latest outbreak to an earlier outbreak this month. So they're now classing all of these cases as the one cluster that started when a 21-year-old woman flew to the Northern Territory from Cairns. She lied on her border declaration form, according to authorities, didn't tell them that she'd actually been in Melbourne for 4 days before coming to Queensland and then to the Northern Territory. We now have those 25 cases here. Most of those people who've been infected are Aboriginal. 2 of them are at the Royal Darwin Hospital. The rest are at the Howard Springs quarantine facility. Yesterday, authorities told us we weren't out of the woods yet. You can tell from that news today that that's certainly the case, and that particular concern about that positive wastewater testing in the community of Binjari.